Hey everyone, welcome to the Guiding You Forward podcast presented by Mountain America Credit Union, where we talk about all things financial related. And today we're talking about Medicare. Sabrina, thanks so much for joining us.
Hi, Kristalina.
Hi. And you guys, Sabrina is on our financial education team. Exactly what do you do, Sabrina?
I am the program manager for Mountain America's financial education team.
Awesome. So we are so excited to learn from Sabrina today. But before we do, hit that notification bell, subscribe to our channel so you can get all our future content. And Sabrina, let's just get right into it with Medicare.
All right.
What is Medicare?
Medicare is set up to provide health insurance, essentially, for individuals ages 65 and up.
Okay.
Since in the United States, many of us get our insurance off of our employer.
Yes.
The government wanted to provide something that isn't necessarily employer-based. Now we do have the marketplace for people who are younger, but when Medicare was set up, we didn't. And so it's Medicare is unique. You have to be at least 65 to get it, and it provides some medical coverage.
How do I qualify for Medicare? Do I have to just be 65 and I can get it?
Sort of.
Okay.
If you are taking Social Security, so you're on Social Security,
Okay.
You're automatically enrolled in Medicare Part A and Part B.
Okay.
It will come automatically. If you are not currently taking Social Security, but you've turned 65 and want Medicare, you need to sign up. And there's a 7-month window. You can sign up 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after.
Okay. All right. So you said Part A and B. Are there lots of parts of Medicare?
Yeah,
okay.
There are actually 4 parts, A, B, C, and D.
Okay.
So Part A is what's known as hospital insurance. And so that's going to mostly cover things like your inpatient hospital, hospice, things like that. Part A does have a deductible. It's a fairly chunky deductible.
Okay.
And it is calculated per benefit period, not annual. So for most insurance, we're used to having an annual deductible.
Yeah.
It resets maybe every January. With Medicare Part A, it is per benefit period. And so if, let's say, Kristalina, you were on Medicare, you go into the hospital to have a knee replacement. Your benefit period starts the day you get in the hospital, and you're going to pay that deductible.
Okay.
And then the coverage will kick in. At that point, the coverage is 100%, which is nice. And your benefit period will end when you're out of the hospital and you haven't been readmitted for 60 days.
Okay.
Yeah. If you do get readmitted on day 61, you have to pay that deductible again.
Okay.
So the coverage is pretty good. Like I said, after the deductible, though it's fairly chunky, you are getting 100% coverage, at least for days 1 through 60. Days 61 through 90, you still got that deductible, but you also have to pay a copay, and it's several $100s per day.
Oh, wow.
And then day 91 plus, it goes up even higher. So you can see, at least in Part A, there are some gaps there of coverage.
Absolutely.
The same thing really goes for Part B. Part B is different. Part B is what they call medical insurance. And so this would be for your outpatient services. You have a sore throat, you want to go to your primary care physician, labs, x-rays, durable medical equipment, all are covered under Medicare Part B.
Okay.
There's a deductible there too. And that deductible is annual. So it runs January to January. So you pay your deductible first. And then once you've met that, Medicare will kick in. They kick in at an 80% coinsurance. So you'd be responsible for the 20%.
Okay.
Let's skip Part C and we'll come back to it.
Okay. Fair enough.
And go straight to D, because now we've got hospital coverage. We've got medical covered. Part D covers prescription drugs, and it's the newest part of Medicare.
Okay.
Yeah. And it may or may not be free. So it's going to vary for individual to individual. But it is nice when this was finally added to the Medicare portion. You also have to elect to take it, and it provides, like I said, coverage for pharmaceuticals. There's always a coverage gap that you could fall into. So there's a certain amount of coverage. There's cost sharing. So you might have co-insurance. You might have copay. It really depends on the plan you pick. It'll give you so much coverage, and then you'll fall into what's commonly known as the Doughnut Hole, and that is what it's called. And this is this coverage gap where once you're in the Doughnut Hole, you can get out of it once you've paid more monies out of pocket, you and your Part D insurance coverage. So
interesting.
Yeah. So there's different almost tiers to it. So you've got coverage, even though there's cost sharing. You're in the donut hole. You have to pay a certain amount, and then you're out of the donut hole, and more coverage kicks in. So it can go in 3 different stages, really.
Okay.
But Part D really, really varies, because this is going to be picked up. You're going to sign up for it through regular Medicare, but then you also need a private insurance company that partners with it to really do the coverage.
Interesting.
Yeah.
Oh my goodness.
Yeah. And so I skipped Part C.
Yeah.
And that's called Medicare Advantage. And I've kind of illustrated there's all kinds of gaps, right? Mm-hmm. And so when people sign up for Medicare and are ready for that to be their coverage, they have 3 options. They can have Medicare coverage only.
Okay.
They can take A and B and D if they want it and live with the gaps. If they can afford it, they'll take A and B and maybe D, and they'll buy a Medicare supplement, which is also called a Medigap plan, and they will plug the gaps. And those have a cost to them. They're run by private insurance companies, but they do cost.
Okay.
The final option is, again, you're still signing up with Medicare, with the government, but you elect to take Part C, which assigns your Part A and B kind of over. And Part C is Medicare Advantage, and that's run by private insurance companies, usually in an HMO or a PPO arrangement. And so you're really, then you have all these choices to make about which Medicare Advantage plan you want. And I guess the advantage of the Advantage plan is some of them can be as low as 0 premium. So the premiums will vary. Cost sharing will vary. There might be coinsurance, there might be copay, but they'll they'll cover everything that Medicare does. Absolutely everything. Plus usually more to make them attractive.
Okay. Now you said there's a HMO, PPO related. What is that?
Yeah. So HMO is a health maintenance organization.
Okay.
And that's the type of insurance where you have your primary care physician and they direct all your care. So if your primary, if you have a rash, you go see your primary care physician, usually they'll give you a referral to a dermatologist. Right. So they're really directing your care.
Yeah.
A PPO is Preferred Provider Organization, and that's where the insurance company, they have contracts with multiple doctors, right. As they do in an HMO. But the difference here is you have a rash, you don't need to see your primary. You can self-direct without a referral straight to a dermatologist.
Okay.
And so it's insurance, like many people, if you're listening and you're working and you have health benefits through your employer, you probably have either an HMO or a PPO type arrangement. And so Medicare Advantage feels very similar and familiar.
Okay.
It's just different coverage.
Okay. So ideally, in today's world, we'd all want C, right?
Not necessarily. I mean,
okay.
C, they certainly are attractive options for a lot of people. But some people don't want to have to deal with a network. They just want to see any provider out there. And so even with the Medicare Advantage, if it's a PPO, you have in-network benefits, which are usually better than your out-of-network benefits. If you just take Medicare and sign up for a Medicare supplement, you don't have to worry about a network. You can go anywhere you want. The coverage is the coverage. So people think maybe it's a little more simple, things like that.
Okay, awesome. Yeah. So there is options for everyone.
There are, yeah.
Okay. So how do you get it? How do you get Medicare? How does this work? You just turn 65 and a check comes in the mail. Here's your Medicare.
Well, if you're 65 and you're already on Social Security, you're going to be auto-enrolled into Medicare, and you don't have to do anything but make your decision. Oh, do I want a Medicare supplement to supplement this, or do I want to instead take on a Medicare Advantage plan?
Okay.
If you're not taking Social Security benefits, you do actually have to enroll. So you do need to do it 3 months before your 65th birthday, during your 65th birthday, like that month, or 3 months after is your window. Some people, though, have health insurance. They're 65 and they're still working, or their spouse is working and they have employer-based coverage. And so the most common question I get is, well, do I really have to take Medicare because I have coverage through my spouse or I have it through where I work? And that answer is really critical, and you don't want to mess it up, because if you enroll into Medicare late, there are steep, steep penalties, and they're for life.
Oh, shoot.
So, yeah. So if the employer-based coverage is for active employees, meaning you don't have coverage because you have a retiree plan, but you're actively at work, the employer coverage is an IRS qualified plan, which you can find out from the HR department, and the employer has at least 20 employees. Then typically you can forego or pause enrolling.
All right.
In A or B, or some people enroll in A, and it becomes secondary. But because Medicare has so many gaps, it usually does nothing for you to have that secondary coverage to your group health plan.
Okay.
The one word of caution I usually do give, though, is if you're in that situation, you have employer benefits, it's a qualified reason not to enroll in Medicare at age 65. But you decide, well, I'm going to sign up for it anyway because it's secondary, and you sign up for A and B. Later, you could get yourself in trouble if you wanted to have a supplement. So let's say at 66, you finally retire.
Yes.
And you're ready. You've already signed up for Medicare, so you go to sign up for your Medicare supplement. Well, those Medicare supplements, not the Advantage plans, just the supplements, they can medically underwrite you. And so what that means is they can ask for your medical history, ask you to take medical tests, et cetera, and they can use your medical history as a reason to deny you if you've had Part B for 6 months or longer.
Oh, interesting.
So if you signed up for it while you're still working and you've waited a year, you've retired, you passed that 6-month mark. If you take the supplement within this first 6 months that you've signed up for Part B, they cannot medically underwrite you. And they have to accept you.
Wow.
There is no medical underwriting on Advantage plans, though.
Okay, there's not. So for most people, what are they getting? What do you sign up for? Just what you need? How do you know? Like, is there
really is no most people. So part of it depends on income, right?
Yeah.
So I will say for most individuals, Medicare Part A is free. So if you've qualified through Social Security, it's free. So if you've got your 40 credits and get that check, A is free. B is not free. There's a premium, and it's going to vary depending on your income.
Okay.
Same with Part D, the prescription drug. For many people, it might be free. For others, some people it could be free, but usually there's going to be some sort of premium. It is going to vary. So depending on your income, if things are tight, you're just going to take A and B and maybe D.
Okay.
Right? If, you've got the money, then it's really your choice whether you want that Medicare supplement, also called Medigap plan, or if you want to go to a Medicare Advantage. The thing to think about is you can switch Medicare Advantage plans every year at open enrollment if you want to.
Okay.
But once you pass that mark of no return, you can't go into a Medicare supplement without medical underwriting. So you have to kind of make that choice right away when you first sign up for Part B. Do I want the supplement route or do I want Medicare Advantage? Because if I say no now to the supplement, later they can ask for all kinds of medical history and they could deny me. Yeah. So they're actually, it's really up to the individual. And so what they need to do is speak to a Medicare advisor.
Okay.
Yeah, there are people, this is what they do every day. They can educate you about all the different supplement plans and all the different Medicare Advantage plans, as well as Part D plans, because that's critical. You need to know all the drugs you're taking. Ideally, you should have a list, and they can help you find a plan where it's most cost effective for those drugs.
Okay.
Yeah.
Okay. So Sabrina, as we're talking through all of this, what really is the biggest difference between a Medicare supplement and then Medicare Advantage?
Yeah. So they seem kind of similar because really, I talked about all those gaps with Medicare, and you kind of blanket those gaps with both. However, with the Medicare supplement, also called a Medigap, you have Part A and B that pays first, And then the Medigap picks up anything that Medicare doesn't cover.
Okay.
So it really is two types of coverage. When you have Medicare Advantage, you have one plan, it covers it all.
Okay.
So you have to have Medicare Part A and B to get Advantage, but when you actually go to the physician, they're only billing that Medicare Advantage plan, which might come from, Aetna, United Healthcare, Cigna, Humana, whomever you have.
Okay.
Everything is covered by them. And when I say everything, up to their coverage limits, of course.
Right.
Yeah.
Okay. So then how does COBRA play into all of this?
Good question. So when we're talking about that, if you have employer-based healthcare, then that is, and if it's a qualified IRS qualified plan, the employer has more than 20 employees, then you do not need to sign up for A and B. You can continue with your employer-based plan. So what a lot of people do is they say, well, I love my employer plan. So when I retire, I'm going to take COBRA and run out that COBRA before I have to get on Medicare. COBRA is not a qualifying reason, nor if your employer offers you retiree health benefits. Neither are qualifying reasons to not get Medicare. You need to sign up for Medicare in almost all circumstances when you're 65, unless you have that active coverage that qualifies. Otherwise, you're going to get hit with penalties.
Okay, interesting. Good to know. So let's say my spouse is still working and has health insurance through work, but I'm turning 65. Am I part of that window? Like, do I need to sign up in that 7 months? What does that look like?
Yeah, really good question. If you're on your spouse's plan, and again, it's an IRS qualified plan, and the employer is more than 20, and you're covered by that plan, you don't have to.
Okay.
And again, some people elect to go ahead and take A and let A be secondary. Some people elect to take A and B. I wouldn't recommend taking B at that time, though.
Why?
Because if you take B at that time, and let's say your husband continues to work there for many years, at 67, he retires, and you lose this coverage. You took B 24 months ago, right?
Yeah.
In that situation, if you wanted to take a Medicare supplement now that you're losing the employer coverage, you've been on B more than 6 months. And with the Medicare supplement or Medigap plans, they are allowed to medically underwrite you if you try to join them after you've signed up for B for more than 6 months.
Okay.
So you could be denied.
Okay.
You could still get coverage under an Advantage plan. There is no Medicare underwriting or medical underwriting for Advantage plans. So you just got to be really strategic and maybe just sign up for A or just hold off.
Okay. So there, like you said, there are a lot of strategies involved here.
Yeah. Not as many as, say, Social Security, but there are definitely some strategies. I think what's more confusing is because a lot of people do like to pick a Medicare Advantage plan or a Medicare supplement, is then diving into the weeds and studying those health plans.
Yeah.
Yeah, that can get confusing.
So, I mean, who do we turn to for all this information, Sabrina?
Yeah, I would strongly recommend that people don't try and pick themselves unless they have an insurance background, right?
Yeah.
Instead, you should seek out a licensed Medicare advisor.
Okay.
So these individuals are licensed, and the best part is you do not have to pay them. Typically, they work for free. They're getting commission on the back end if you purchase a supplement or an Advantage. But a good one is going to guide you based on your needs.
Yeah. So how do I find one of these Medicare professionals?
Yeah. Good question. A couple things you can do is you can just Google licensed Medicare insurance advisor and then put in the name of your city or your state.
Okay.
They do need to be licensed where you are. That's why I recommend adding your state. You'll definitely get the results. Another thing you could do is go to macu.com, click on the investments tab. That'll bring you to Mountain America Investment Services. And our wealth advisors constantly refer people to licensed Medicare advisors.
Okay.
We have relationships with individuals, and they'd be happy to refer you on.
Okay, awesome.
Yeah.
So the person I'm already meeting with to help me with my retirement, that wealth advisor can just say, hey,
they can make a referral
Yeah.
for you.
Go and meet with so-and-so regarding your Medicare needs too. Oh, that's nice.
Absolutely. Folks should, especially because it really won't cost you anything. And there is so much to know. A licensed person is really going to be a big, work for you, going to be in your corner.
Okay. And they'll be able to say, hey, because of this, this, and this going on in your life, you should go with Advantage or A and B with a supplement or whatever it looks like. Okay.
Ultimately, it is up to you, but they'll definitely, a good one will listen to your needs. A good one will also be able to answer questions like, oh, I'm thinking of going on COBRA instead of this. And they'll be like, time out, you don't do that and help you avoid penalties.
Okay. Yeah, lots to know. Anything else we need to know about Medicare, Sabrina?
Oh, there's lots, but there are certainly a lot. But if you really want to get into the weeds, I definitely would recommend that talking to a licensed advisor.
Okay. So as we're approaching the age of 65, that's when we should meet with one. When is the best time to go and meet with a Medicare advisor?
Yeah, if you're approaching 65, meet with them in advance. So remember the sign-up window, if you're ready for Medicare at 65, because you don't have that qualified group health plan, the earliest you can sign up is 3 months in advance. So at that point, sign up for Medicare and then get on the phone or have a Zoom call or meet in person with a licensed advisor.
Okay, awesome. Well, thank you so much for sharing all the ins and outs of Medicare with us. I mean, there's a lot more that we didn't talk about today, but for the basics, it's been super helpful to understand that. We sure appreciate your time.
Absolutely. Thank you.
And thanks to all of you for joining as well. Again, don't forget to hit that notification bell and subscribe to our channel for all the rest of our Guiding You Forward content. And we will see you guys on the next episode of Guiding You Forward.